The use of the OPD-3 for premium IOL patients has become an integral part of what we do as a practice. It is not uncommon for patients to be referred into our practice who have had multifocal lenses or toric implants done by other surgeons and who have done wonderful surgical results, really wonderful surgical outcomes. And for one reason or another, they're not altogether pleased. And bringing a patient like that in and sitting them down at a machine that can give you an answer in a very short period of time that can lead you to a diagnosis as to why it is a patient may be unhappy is a remarkable feat. And certainly it is something that patients respond to quickly within a moment or two. Sitting in your exam lane, looking at a slip of paper or on your electronic medical records that tells you a few things with regard to the location of the implant or residual refractive error that oftentimes goes unnoticed with other machinery or even in a clinical exam, truly leads itself to an opportunity to achieve better patient outcomes. A case study that I think certainly illustrates what it is that I am alluding to certainly would be a patient, for instance, who has a toric implant. The beauty of the OPD-3 is that it gives you not only information with regard to the front of the cornea, but gives you quite a bit of information with regard to how light passes all the way to the back of the retina, even beyond the surface of the cornea, i.e. either the back of the corneal surface or even in the case of a toric lens, the actual location or orientation of the implant itself. And it's a wonderful way to illustrate what can happen when an intraocular lens of the toric variety is off axis. And more importantly, as I said, a picture can be worth 1,000 words. Illustrating that, demonstrating it to a patient, really sets them at ease when you're able to sit down and show a patient exactly what it is that has led to their less than stellar outcome. The patients and staff alike in my practice have adopted the use of the OPD very easily. The OPD-3 is really the second generation of instruments that we've had of its variety. And the upgrades are rather remarkable. It makes the patient interface much easier. Patients are much more satisfied with the experience. It's much faster, which also contributes to a much happier technical staff. We're able to move patients through with greater efficiency. The results are better. We're able to do this on a regular basis, so I'm happier, which means that my bosses are happier, and at the end of the day, we're really trying to make sure that our customer experience, and I'm sometimes reluctant to say that, but in all sincerity, and with a private practice that is heavily based in premium products, patients become customers. And making sure that your customers are happy is certainly the key to a happy and vital practice. The use of the OPD in better refining the exact type of implant, I think, is a critical aspect of achieving premium outcomes for patients, and that includes even monofocal lens as well as multifocal lens, certainly. But looking at an implant as it applies to a particular patient, but let's be more specifically, applies to a specific pupil size, is also very important. And what the OPD-3 does, it takes the place of multiple machines in your office. It allows you to evaluate a refraction across different pupil sizes. And that is particularly important when you're looking at aspheric implants that have relatively different powers across the lens optic. That also will allow you to evaluate patients under less than stellar optical scenarios, such as driving at night. Being able to determine what very well may be the best refractive calculation for a patient with these aspheric lenses is much easier achieved when you're able to look at a patient's refractive outcome across different pupil sizes. The biggest difference that occurred when we adopted the OPD-3 was efficiency. We all try and achieve high quality outcomes, and we certainly want to make sure that we're getting very precise and extremely accurate calculations and measurements. That oftentimes in a traditional practice will take an inordinate amount of time and effort, not only from your technical staff, but as you as a physician or a surgeon. And what the OPD-3 was able to do was capture so much information, a wealth of information, in a matter of seconds. And when it does that, it allows for the patient experience to improve tremendously and more efficiently, not only for your practice, but once again for the patient, And as a result, you put them in a positive place moving forward, which allows you ultimately to get to a place where they're going to be happier. The importance of centration with an implant is particularly key when you are leaning towards not only aspheric implants, but certainly multifocal implants. And it is not uncommon to encounter a patient in your clinic who very well may have a significant discrepancy of line of sight, or what we sometimes will call angle kappa, but more importantly call angle alpha. And that is something that is easily measured with the OPD-3. Numbers such as 0.3 or greater of angle kappa is one way of identifying a patient just as they enter the door that may not necessarily be a very good candidate for multifocal implants. And if you choose to do an implant of that variety, I would certainly make a strong argument to paying a little extra special attention to how it is you address that individual at the time of surgery. And that is something that is an imperative part of the surgical workup that in most instances can only be evaluated with the OPD-3.